Hey everyone, this is Holly Knutson. I'm a functional health practitioner from Utah. And for this video, I want to talk about the 3 stages of Lyme disease, along with the symptoms and natural therapies. Lyme disease progresses in 3 stages, with symptoms ranging from mild to debilitating if left untreated. Knowing the symptoms and getting an early diagnosis is critical for treatment success. Well, what is Lyme disease? Lyme disease is the most common vector-borne illness and is caused by the borrelia burgdorfei bacterium, or spirochete. Spirochetes are shaped like a corkscrew, and this enables them to burrow deep within tissues where they can remain undetected by the immune system. The disease was first identified in 1975 in Lyme, Connecticut, hence its name. 2 years later, the deer tick, who becomes infected while feeding on mice or deer, was implicated in the transmission of the disease. Tick bites become infectious if a tick isn't removed within 12 to 24 hours, which allows them to feed. It's possible that ticks aren't the only insects that transmit the disease. Mosquitos, mites, fleas, and even flies may be carriers as well. Sadly, evidence shows that the infection can be transmitted during sex, pregnancy, and possibly even breastfeeding. Lyme is often called the great imitator because it can mimic other diseases, with symptoms appearing, then disappearing, and reappearing, and is notoriously difficult to treat. In fact, spirochetes behave similarly to viruses in that they can be intracellular and can take on different morphologies, including the cystic form, which can persist similarly to the bacteria that causes syphilis. Cystic forms of Lyme can be treatment resistant. And one reason the disease is so hard to treat is that spirochetes encase themselves in biofilms, mucus-type encasements that prevent antibiotics from reaching them. Localized Lyme disease, or stage 1, can last anywhere from 1 to 4 weeks, and symptoms can manifest from 30 to 30 days after getting bit by an infected tick. The hallmark sign of this stage of Lyme is a bullseye rash, which is an allergic reaction to a tick's saliva. The rash can gradually expand up to 12 inches in diameter and may be warm to the touch. These rashes aren't typically painful, though. However, many people don't get a rash after being infected. The ones who do get a rash are actually fortunate because it confirms the presence of the disease, and the earlier the infection can be identified and treated, the better. Many people are asymptomatic in this stage. For those who do have symptoms, they include swollen lymph nodes, fever and chills, sore throat, joint pain, fatigue, headaches, stiffness and swelling, and the bullseye rash that I mentioned. Early disseminated Lyme disease, or stage 2, begins weeks or months following infection, with symptoms of stage 1 and stage 2 potentially overlapping. In stage 2, the bacteria spreads and multiplies throughout the body, and this results in worsening symptoms. Borrelia is unique in that it can penetrate the blood-brain barrier, infecting the central nervous system and causing inflammation. This can lead to the extreme fatigue that a high percentage of people with Lyme experience. Neurocognitive problems like memory loss and inability to concentrate and lack of coordination can begin to manifest in this stage. Brain inflammation can cause intense migraine-type headaches that are accompanied by extreme sensitivity to light or noise. If the disease remains untreated, the worsening infection can even lead to behavioral changes. Other symptoms include enlarged lymph nodes, fatigue, muscle aches and flu-type symptoms, fever, chills, and sore throat, neurological symptoms, rashes, sensitivity to both light and noise, pain, tingling, and numbness, headaches, changes in vision, heart arrhythmias and palpitations, and meningitis. Late disseminated or persistent chronic Lyme disease is stage 3, and this late stage of the disease can occur months or sometimes years after being infected. Symptoms can be life-threatening and severe. As the bacterium spreads, it affects the heart, brain, nervous system, and musculoskeletal system, including substantial joint damage. Lyme was originally called Lyme arthritis due to this negative impact it has on joints. Arthritic type symptoms can wax and wane, and this can affect the knees, hips, and other joints. As the inflammatory process progresses unabated, tissue is damaged and bone and cartilage attacked. Spirochetes can invade heart tissue, causing inflammation, tachycardia, heart palpitations, dizziness, shortness of breath, and fainting. Stress of any kind, and this includes exercise, can make the symptoms worse. Flu-like symptoms are the result of the immune system trying to fight the infection. These symptoms differ from garden variety flu symptoms in that congestion and coughing aren't part of the picture. The longer the disease progresses without intervention, the harder it becomes to treat. As it becomes chronic, antibody production is suppressed due to stress on the immune system, and this makes it even more difficult to diagnose. Symptoms in this stage include arthritis, brain disorders, neck stiffness, fluid buildup, headaches, numbness, temporary amnesia, heart problems, nervous system disorders, exhaustion, liver disease, paralysis of facial muscles, and memory and concentration problems. Now I want to talk a little bit about conventional treatments for Lyme disease. Receiving a Lyme diagnosis is not a simple matter, and this is very unfortunate because if the disease is diagnosed early and treated, the infection can be eradicated. Ticks are tiny, and people often have no idea they've been bitten. Many people chalk their joint pain and muscle aches up to other more common conditions. And to complicate matters further, borrelia runs in a pack with other co-infections like babesia, which is a malaria-type parasite, and Bartonella, a gram-negative bacteria. Physical exams, health histories, and blood tests are used to diagnose the disease. Spirochetes can be seen on live blood analysis using dark field microscopy. Blood tests are the most accurate in the early stages of the disease when antibodies can still be detected, but false negatives can occur up to 1/3 of the time. The disease is conventionally treated with antibiotics, including doxycycline and amoxicillin. Antibiotics that work intracellularly are also used. Symptoms such as joint pain, however, may not completely resolve after treatment. Blood tests that are used to diagnose Lyme include the ELISA assay, which detects antibodies against the borrelia bacterium, the Western blot that identifies antibodies against borrelia proteins, and polymerase chain reaction, or PCR, which evaluates spinal and joint fluid. And this test specifically is used for people who present with Lyme arthritis and neurological symptoms. True Health Labs offers a variety of tests you can order online yourself without a doctor's order, and I'll put the links underneath this video. Lyme can be treated alternatively, either in conjunction with conventional treatments or alone. A number of healing modalities are used simultaneously, and many of them can be done at home. And these include herbal antibiotics, which are used alternatively for Lyme because of their ability to get inside the cell. Cemento, olive leaf extract, grapefruit seed extract, systemic enzymes, and colloidal silver are a few examples of non-pharmaceutical antibiotics. The Cowden Support Program has been used with great success, and it uses 4 Nutramedix products that are rotated. Homeopathy is also used for Lyme. Vitamins, minerals, and antioxidants can be delivered intravenously as an alternative therapy for Lyme. And intravenous therapies bypass the GI tract and strengthen the immune system. Also, detoxification strategies, techniques such as juicing, colonics, coffee enemas, liver cleanses, and rebounding are used to detoxify the liver, gallbladder, lymph, and intestines. And detoxification is critical for the immune system to function as it should. HBOT, or hyperbaric oxygen therapy, is another alternative therapy for the infection. The borrellia bacterium is considered microaerophilic, which means it requires small amounts of oxygen for survival, but dies in the presence of copious amounts of oxygen. Hyperbaric oxygen therapy modulates immune function, detoxifies, increases energy, and reduces pain. Rife therapy is another alternative treatment. All organisms, including bacteria, resonate at specific frequencies. A Rife machine is able to eradicate pathogenic organisms by directing beams that are programmed at the same resonancy. Rife is used for general healing, pain reduction, and depression. And it's cost-effective to purchase your own Rife machine to use at home. PEMF, or pulsed electromagnetic frequency therapy, stimulates cellular repair by delivering magnetic pulses to tissues, raising the membrane potential, which improves cell metabolism. PEMF therapy has been shown to produce an analgesic effect, is used to reduce inflammation, oxygenate the body, improve circulation and nutrient absorption, and promote lymphatic drainage and detox. The most effective way to receive the benefits is to buy your own pulsed magnetic field generator. Ozone is a powerful biofilm buster and is anti-inflammatory, antiviral, and antibacterial. It improves immune function and circulation, protects the liver, stabilizes moods, improves cellular metabolism, boosts energy, and eliminates joint pain. Ozone can be administered in a variety of ways, including intravenously and by direct injection to repair joints, ligaments, cartilage, and tendons. And this makes it particularly applicable for Lyme arthritis. Again, you can buy your own generator to use at home. Far infrared saunas. Detox is vital for people with Lyme because spirochetes release toxins as they die, so it's imperative to up your detox techniques when treating the disease to prevent Herxheimer reactions, which is a result of toxin buildup. Sweating releases environmental toxins, heavy metals, and other toxic chemicals. Saunas support the immune system, decrease pain, improve circulation, and promote relaxation. And sauna therapy can be enjoyed in the comfort of your own home. Acupuncture. Stimulation of acupuncture points activates pathways that strengthen the immune system. Acupuncture can improve the symptoms of Lyme by decreasing inflammation, improving circulation and pain, and promoting relaxation. Medical marijuana. Cannabis can be a great option for reducing the symptoms of Lyme. It relaxes muscles, reduces inflammation, improves stiffness and joint pain, and aids in restful sleep, which can be elusive for people with Lyme. In summary, the saying, "an ounce of prevention is worth a pound of cure," is particularly relevant in the case of Lyme disease, which is difficult to diagnose due to the ability of spirochetes to evade the immune system. Once the acute form of the disease progresses to chronic, it can be very hard to treat. Protect yourself by wearing long sleeves and pants when hiking or walking in grassy areas. Perform frequent tick checks on your entire body as well as on any pets. And get any suspicious symptoms checked immediately. Were you aware that Lyme disease had 3 stages? Please take the time to leave a comment below. Thanks so much for watching.